and mental health. So present layout, definition of naturopathy, historical perspective of naturopathy, basic concepts and principles of naturopathy, evidence-based naturopathy addictions, naturopathy evidence in withdrawal symptoms and complications, future directions in naturopathy related to research as well as clinical activities, and to summarize and conclusions. So definition, naturopathy is a system of man building in harmony with the constructive principles of nature on physical, mental, moral and spiritual planes of well-being, which was given by Henry Lindlaw, who is a known naturopath from USA. So naturopathy was created from natura, the Latin root for birth, and pathos, the Greek for suffering, to suggest natural healing. So Hippocrates has been known as the author of modern medicine, but he is also one of the earliest predecessors of naturopathic medicine. He had given many naturopathic principles, which was used in complementary with other medicine. He taught that nature is healer of all diseases, and subsequently, along with the European naturopaths, and it has been spread to America, then to India and China and other parts of Europe. So particularly Gandhiji, Mahatma Gandhiji, father of our nation, was influenced by the book Return to Nature, written by Adolf Just. So during the freedom struggle between 1920 to 1947, during that time he started using naturopathy for himself and even started advocating for its beneficial effects. So naturopathy particularly has been taking Pancha Mahabhutas. So we have natural 5 elements. So that each and every treatment modalities has been framed out of this. Particularly, for example, space we have fasting therapy. Then fire we have Akash therapy and even chromotherapy. Then water hydrotherapy. Then here we have breathing exercises, yoga and other things. And earth we have mud therapy and some of the herbal botanical medicine and all those things. So basic concepts about naturopathy. So mainly three primary causes of disease, namely lowered vitality, abnormal composition of blood and lymph, accumulation of waste matter and poisons in the system. So poisons in the sense some of the chemicals from environmental toxins or environmental chemicals which we consume. We assume that some of the even sugar also one of the poison. So in the same manner, accumulation of waste like some food which we consume, it may not be digested, it may not be absorbed and assimilated properly. So that remnants what we call waste or moving matter. And lowered vitality, if we reduce our energy, like by thinking very negative thinking or involving in some of the bad habits, some addiction or sexual indulgence or overworking or over stressful. So these causes reduction in energy. And abnormal composition of blood and lymph, again it depends on what kind of food you consume. So we consider diet as medicine. So if we don't consume proper food and digestion doesn't happen properly, absorption doesn't happen properly, so we will have abnormal composition of blood and lymph. So whole thing like we look at as a holistic concept. So we look at unnatural habits and even factors which is involved, which is the root cause of disease. So Hippocrates had given vitalism is a concept. He said disease from imbalance in vital forces. So he had different personality level, which is similar with the psychiatric conditions. 4 temperaments he had given: sanguine, choleric. Sanguine people will be optimistic and social, and choleric they will be short-tempered and irritable, and melancholic they are analytical and we could see in major disorder. And phlegmatic, relaxed, they will be more relaxed and they will be peaceful. So 4 humors he had advocated, which again talks about different personality and different behavioral pattern of an individual. Blood, yellow bile, black bile, phlegm, which affect human personality traits and behaviors. So this picture has been displayed in Germany. So by the unknown artist, so which depict these 4 temperaments. So principles of naturopathy. Naturopathy has many principles. So particularly with relevant psychiatry or some of the medical conditions. So facilitating the healing power of nature by using natural and natural sources with the use of Pancha Mahabhutas. The main cause of disease is innervation, nerve fatigue. If we become like, if you think really, if we work more, our nervous system will become weaker. So fatigueness we feel. So deposition of metabolic end products in the body is disease. So many times what happens, even in patients with jaundice or metabolic end products will be start accumulating in the body, and which gives rise to disease condition. So those end products should be eliminated from the body. So elimination is one of the main principle which you use in naturopathic treatment approach. And do not harm anyone with any chemicals or any natural. For example, organic farming has been very much popular now. So in most of the naturopathy, some of the very big naturopathy hospitals, we have they give to the patients organic vegetable fruits, so that it doesn't contain any pesticides or chemicals. So to identify and treat the cause, not just symptoms, we treat the cause as a whole. And fasting provides an opportunity to the body to heal itself. It doesn't cure the disease, but it gives an opportunity to heal itself. So it's like fasting and starvation. There's a huge difference. Fasting will start, then within 24 hours carbohydrates will be utilized, then fat will be utilized in the form of energy. So we don't have to worry about, because some of the nutrients will be utilized when we do fasting. And protein utilizing, that is the time when starvation starts. So fasting is much useful even for cancer also. Nowadays some research has been showing fasting is very useful for cancer. And exercise and physical activity keeps the balance between nutrition and drainage. Treat the whole person as a whole, and prevent the disease and ill health, where naturopathy plays a very significant role. And establish the health and wellness, here also naturopathy plays a very important role. So before disease come, we need to use different lifestyle modifications pertaining to diet and exercise, or behavior, or nutrition, exercise, relaxation. So these things will be useful to establish the wellness. The practitioner is a teacher. So usually what we do, we don't spend only 5 or 10 minutes in front of the patient. We give more than 1 hour when they come the first time. So we look at all the parameters when we do clinical assessment. So naturopathic diagnosis, we have facial diagnosis and iris diagnosis. Though the principles have been used since decades, so the evidence has been lacking. But recent evidence which suggests, in coordination with addiction, people with blue eyes might have a greater chance of becoming alcohol dependent by genetic researchers. So which was published in American Medical Genetics in 2015. So in a similar way, some of the medical conditions, like if they have heart problem, particularly in the heart area, what we could see here in the this particular area, they will have some discoloration of the eye, or they may have some nerve ring which will be formed up. Even in addiction also some discoloration will happen, but there is no much evidence for this. With respect to what patients can expect from naturopathy consultation, assessment, usually we rely upon the modern way they do in patient psychiatry or other medical conditions. We take detailed case history, including family history and social history, sexual history, and other things. And even examination, physical examination, general physical examination, system examination we do. Along with that, we look at even facial diagnosis also for some extent, facial iris diagnosis. So clinical nutrition management, for each and whenever they will come to our hospital, particularly naturopathy is beneficial, they come and get admitted in inpatient department. Outpatient also we have good results, but inpatient we have better results. So we advocate food according to their conditions. For example, conditions, some nutritional guidelines which I am going to talk about, that will be advised to them. For diabetes mellitus, according to the glycemic index, we advise some dietary like that. And fasting therapy we advise, but particularly for psychiatric conditions, we don't straight go and advise fasting therapy, otherwise they will run away from the hospital. So gradually we will start. Particularly naturopathy will be useful not during acute intoxication. So during that time, allopathy best, they have to deal with case. But once they get come out from that, when they at least at the beginning of the detoxification or after 10 days of detoxification with vitamin tablets or benzodiazepine, then we start with naturopathy treatment. That will be more, as it will be very difficult for us to manage. Probably prevention aspect, naturopathy best, and after detoxification or at the beginning of detoxification, naturopathy can be given as an adjuvant therapy, and after treatment to reduce withdrawal symptoms or even complications. We don't have the enough evidence for that, but indirect evidence which suggest naturopathy will be useful for most of the non-communicable diseases, lifestyle related, stress related non-communicable diseases. Even lifestyle management which is one of the very important aspect which we do. In acupuncture we have considerable evidence. Hydrotherapy, we have several techniques like GH pack, which is commonly used for patients with addiction patients, where liver damage has been happened in the form of cirrhosis or alcoholic liver disease. So particularly a very useful technique. We usually use fermentation on the abdomen. At the back, we keep cold and we cover with the blanket. So we will keep it for 20 minutes. That will be very useful. So after that, we have other treatments like neutral underwater massage, or that will be very useful to those who have insomnia, sleep disturbances. Very useful, like neutral water. So different temperature which we use that has different physiological effects on our body. And exercise therapy, which has been very useful, we advise. And others also advise this. Then massage, mat therapy techniques. Then botanical medicines, whenever it is required, we use that. Usually in Indian inpatient department, botanical medicine is not being used much, but in OPs and even in abroad, if you compare naturopathic medicine in Canada, or, Australia, USA, they use more botanical medicine. And yoga therapy and counseling also very important, because naturopathy and yoga is the system, Ayush, one of the Ayush system, what we call yoga and naturopathy. So yoga therapy and naturopathy is one system. It is two sides of same. So if we miss yoga, the mental aspect like stress level and all those things. Naturopathy, which deals with reducing the toxins which is accumulated in our body. Toxins in the sense, if we talk scientifically, like chemicals or some of the undigested or assimilated, unabsorbed food particles. All those things can be explained with naturopathy. So JT, we give more emphasis in naturopathy. So why naturopathy and yoga for substance use disorders? It's free from side effects and no risk of self-poisoning if given with a proper direction with the qualified naturopathic yoga doctor. So emphasize on prevention aspect, integrated treatment approach. We look at all these domains like physical, mental, emotional, and spiritual well-being of a person. History suggests the use of natural therapies in psychiatric hospitals. Particularly in USA, they used to use these therapies, particularly to reduce the side effects of psychiatric medications. So once after 1910, allopathy become more popular. So naturopathy approach has declined. So in late 1980s, it has been taking its shape. Like most of the people started using camp treatment, complementary and alternative medicine. Naturopathy and yoga is one of the main part in that. So may aids in preventing or reducing side effects of medication, acts as a supportive treatment for withdrawal symptoms, complications associated with addiction. Direct evidence, but yeah, it will be useful. Can be used as a complement to conventional system of medicine. Some evidence-based modalities which we have, like polyunsaturated fatty acids, which we use in naturopathy, and acupuncture and yoga and exercise, etc. So naturopathy and yoga addiction treatment, it can be used. Evidence is there with alcohol addiction, nicotine addiction, cocaine addiction, morphine, heroin, opioid addiction, and opioid methadone stimulant. We have some evidence. And withdrawal symptoms and complications, we don't have direct evidence. However, the evidence is there for non-communicable diseases, lifestyle-related disorders, and even psychiatric conditions like depression, anxiety disorder, and cognitive deficits, insomnia, so seizures, insomnia, anxiety, hypertension, which we could see stage. And the particular complications, alcoholic disease and cirrhosis, naturopathy can play a very important role. So what is drug addiction? Addiction is a chronic disease characterized by drug seeking and use difficult to control despite harmful consequences, which was given by National Institute August 2016. So these are some of the areas which is involved prefrontal cortex, nucleus accumbens, and ventral tegmentia. Particularly teen-aged people because this prefrontal cortex is not much developed, so behavior and other aspects, cognitive functions will be less among them, and they are prone to addiction. So activation of reward addictive drugs, because of more dopamine release, they will have emphasize on the reward pathway. So as day goes, so brain start producing less dopamine, and then they will become more prone to taking alcohol or other addiction aspects. So naturopathy treatment beneficial in addiction as a prevention aspect is very useful. Like as I said, after detoxification or aerobic detoxification, we can advise yoga and naturopathy, which can be clubbed with allopathy to yield more results, which would be useful to reduce these withdrawal symptoms, side effects of medication, and even complications. So more likely what we do in naturopathy, we involve families and schools, even school education, which we give related to naturopathy and yoga and addiction and other lifestyle related disorders. Communities, VH, and media also plays a very important role. Education we give, so by showing different pictures of complications will be caused due to different addiction, awareness programs related to that, preventive measures which we take, other outreach activities, and moral values of a particular relevance. So what I could see, those who come to yoga and naturopathy hospitals, they start learning moral values along with the treatment. So they will be involved in prayers and spiritual well-being and satsanga. They get together with other people around. So they want to become like others. So those moral values and lifetime education, like guidance which we give them, and what will be consequences and complications of addiction and all those things, which we will explain during that class. And exercise, yoga therapy, yogic counseling. Yogic counseling is of a particular relevance. Already Dr. Sneha has spoken about yoga in detail, so I don't talk much in detail now. But however, some of the traditional texts like Patanjali Yoga Sutras, Yoga Vasishtha, Bhagavad Gita, there are a lot of psychological components has been, which we call Indian psychology. More likely we depend on Western psychology. Indian psychology also has given a lot of psychological inputs. So particularly if we think about Vitarka Padane, Pratipaksha Bhavan, whenever we have negative thoughts, if we have to bring opposite thoughts to our mind, positive thoughts. So and even by adopting friendliness and to have a balance between dualities, happiness and sorrow, and angerness and calmness. So all those things which will be useful. And dietetics and nutrition management also, particularly polyunsaturated fatty acids, which is more likely in walnuts, flaxseed, and even some of the fish oils in particular relevance. So nutritional healing, as the previous aspect, neurotransmitters in the brain control our moods, and the foods which we eat control the release of neurotransmitters. So even Vibhakta said what food is the medicine. So complex carbohydrates, particularly not simple carbohydrates like sugar or jaggery or other simple carbohydrates. Complex carbohydrates such as not polished rice or unpolished rice, semi-polished wheat or other oats, and all those things are very useful to calm down the mind. And proteins particularly, which plays a very important role in terms of hormones or neurotransmitters, which increase the alertness. That's why we advise or even children and the public to take both protein as well as complex carbohydrates in the morning, so that they will be alert in their work or in the school or in other administrative work. So even certain minerals highly implicated in psychiatric disorders like magnesium or folate, folic acid, vitamin B12, and vitamins, particularly antioxidants, which plays a very important role, B complex vitamins. Then minerals, zinc, selenium. Then essential fatty acid, polyunsaturated fatty acids, which have a very significant relevance. And other nutritional supplements also may be useful in controlling some of psychiatric disorders, including addiction and autism. So, with respect to evidence related to addiction with Naturopathy Yoga, so complementary treatments for tobacco cessation survey was conducted on 1,175 patients. A total of 27% of the patients reported previous usage of CAM treatment for tobacco cessation. Most commonly received to be efficacious according to their opinion were yoga, relaxation, meditation, and massage therapy. A total of 67% of the patients reported interest in future use of CAM for tobacco cessation, particularly female gender, and those who were more educated and previously used tobacco cessation program. And with respect to acupuncture, we have considerable evidence. Acupuncture and alcohol dependent. Acupuncture is one of the Chinese systems which we use in naturopathic modality. So again, acupuncture, which has main concept about Qi. In yoga, we have main concept about energy, prana. So it's almost similar concept which we have. Even they believe in Pancha Mahabhutas, naturopathy also, like other traditional naturopathy also believes Pancha Mahabhutas. So that is the reason acupuncture is one of the treatment modality in naturopathy, which is 5.5 years medical course where we study acupuncture as a treatment option. So, acupuncture, like 5 points we stimulate with the help of needles. In electroacupuncture, we use electric stimulation, which has less than 9 volts. So, with respect to alcohol addiction, they have done it in preclinical rodent models. So, Shenman, like HT7, they have inserted the needle, so which attenuated GABA B receptor mediated increase in ethanol induced dopamine release in the nucleus accumbens in rats. So which is of a particular relevance with addiction patients. Then cocaine, they had given auricular treatment. Sample size is very good and is a single blind study. So they had given 5 times weekly for 8 weeks acupuncture treatment, auricular acupuncture. So we have points even in the year. And they had compared with needle insertion in different body parts and even relaxation. So they could see after 6 months of follow-up, they could see abstinence rate. Auricular acupuncture, they had abstinence rate around 43.1%, needle insertion 46.9%, and relaxation 35.5%. It is almost comparable. It is there is no group between each. However, auricular acupuncture insertion is useful. Other studies also with similar other medical conditions like migraine and particularly acupuncture is very, very useful. So there also some evidence suggests acupuncture on specific migraine is equivalent or comparable to sham acupuncture. Like other points they use as a control modality. So we could see similar kind of result here. So no evidence acupuncture used as a treatment. It can be used as a complementary treatment with fixation or medicine. Limited evidence as an adjunct therapy. So with respect to opiate addiction, acupuncture or electroacupuncture attenuated behavioral signs of opiate, particularly anxiety, depression, and other features, which are symptoms associated with rapid opiate detoxification. It is beneficial as an adjuvant therapy and increases abstinence rate. Acupuncture, again, same important point, part 7, decreased dopamine release in nucleus accumbens and behavior activity induced by morphine in rats. So botanical medicine like licorice root can be used to eliminate toxicity, and ginseng can be used to improve the immune function. It acts as anti-aging and anti-stress hormone, and it enhances the cognitive functions. So acupuncture for psychological symptoms in opioid addiction, they could see improvement in anxiety and depression. Groups did not define opioid craving. However, 10 out of 16 studies reported positive findings, particularly psychological symptoms. RCTs with long-term are warranted. Is a review which was done. So main point they used pericardium 6, stomach 36, spleen 6, HT7, large intestine 4, pericardium, ear point like kidney, liver. So acupuncture and Methadone addiction are 10 days therapy of Methadone and acupuncture at points of due channel they had given, in control group only they had take Methadone consumption group. Then acupuncture points they had given these points. Everything was done on abstinence symptoms. Acupuncture, they concluded that acupuncture has an therapeutical effect on symptoms of heroism, which can effectively help alleviate the abstinence symptoms, particularly perspiration, anxiety in the muscle and bone. So, possible mechanism of acupuncture action. Acupuncture treatment suppressed ethanol-induced dopamine in the rat's nuclear sequence through GABA-B receptor. Acupuncture at stomach 36 attenuated nicotine-induced behavioral sensitization and even genetic expression, CFO expression in the nucleus accumbens and striatum, thereby play an important role in suppressing the reinforcing effects of ethanol and other drugs. Further, electroacupuncture attenuated elevated CFOS expression in the central nucleus of the amygdala during morphine withdrawal in rats. These are of particular relevance because this particular has been highly implicated in the pathophysiology of addiction. To summarize, the acupuncture works by modulating mesolimbic dopamine neurons, so limbic system, which is much involved in addiction and psychiatric conditions, so which to do with emotional regulation, which can be regulated with acupuncture. Modulating mesolimbic dopamine neurons, and also by modulating neurotransmitter systems such as serotonin and opioids, natural opioids, and amino acids including GABA. And evidence related to polyunsaturated fatty acids and cocaine abusers, EPA and DHA may influence serotonergic neurotransmission in humans, presenting elements in the serotonergic function in cocaine abusing individuals. So 3 grams of long-chain omega-3 fatty acid per day has shown to reduce the feelings of anger in some abusers, though the sample size is less, so we could see this as a preliminary further study. And omega-3 fatty acids group showed a greater improvement in anger and anxiety compared to placebo in drug abusers. Possible mechanisms of PUFA. We know that lipids are very important. We think that fat is not good for our health. So fat is the main component of plasma membrane, and we maintain the fluidity and the function of plasma membrane to cellular signaling, and PUFA is very, very important. Neuronal membrane fluidity that can be altered by their PUFA composition and affect the function of neurotransmitter functions. EPA counteracts the toxic effects of these substances in the brain, being an anti-inflammatory. So we thought that omega-3 fatty acids earlier, evidence which suggests 20:1, omega-6 to omega-3. But now the evidence suggests it should be 1:1 because omega-6, which is inflammatory, pro-inflammatory, and omega-3, which is anti-inflammatory. So we know that majority of the medical conditions nowadays, one of the main important pathophysiological feature is the inflammation that can be reduced with the help of PUFA. So EPA-derived mediators have vasodilating, anti-aggregating, and anti-inflammatory actions. Modifications of serotonergic neurotransmission implicated in violence. Finally, PUFA and metabolites regulate gene transcriptions. These are of a much pathological importance. Then subsequently, aerobic exercise and addiction. So in preclinical studies and even subsequent human studies also have been done. So aerobic exercise, wheel running may reduce relapse vulnerability by preventing the increase in cocaine-seeking behavior. And previous practice of regular physical activity, which are humans, 8-week treadmill program may help preventing amphetamine addiction. And exercise may prevent drug addiction by altering FOS-B or CFOS immunoreactivity in the striatum or other parts of the reward system. So exercise and alcohol use disorders. So 11 human studies were identified. 6 of those studies, exercise may have positive impact towards alcohol consumption, abstinence rates, or the urge to drink. Exercise affects the endogenous opioids, which are associated with the urge to drink. Early promising evidence for the role of exercise as an adjuvant tool in the treatment of alcohol use disorders. So particularly exercise, regular practice for 3 months, at least for half an hour, like moderate to severe intensity, like some jogging or aerobic exercise for 1 hour. This for 3 months, it will be very useful for them. Naturopathy evidence in patients with depression. Though we don't have direct evidence linking depression and alcohol, we know that depressive patients are more prone to consume alcohol and other behaviors. They will be indulged in. So good evidence we have seen with 2002 review, omega-3 fatty acid, St. John's wort, which we use for depression. You see in this picture. Then exercise therapy, light therapy, particularly in winter depression, electroacupuncture. So limited evidence for manual acupuncture, then light therapy, massage therapy, relaxation, deficiency which you could see in depression, yoga, breathing exercises, gluten-free diet, and even some case reports and single case study. Cold shower is useful for patients with depression. And then fasting therapy has been shown to enhance alpha waves, so particularly useful for depression patients. So, particularly for complications of addiction, though we don't have direct evidence, naturopathy has been widely used in these non-communicable lifestyle-related disorders. So, obesity, main culprit is not fat. It is low. If we consume more high-calorie, high carbohydrates, particularly simple carbohydrates, and semi-polished rice or semi-polished wheat things, which give rise to more weight. So some of the research studies have been done, and even high-protein diet. Earlier they thought they will put on weight. It's not so, since it has the effect and which fulfills the satiety center, which is of a particular relevance. And calorie restriction by 20 to 40%, which we commonly use in the setup. We reduce the calorie intake for around 20 to 40%. They are shown to reduce the weight. And even aerobic exercise and fasting is particularly very useful. And hypertension, fasting therapy is useful. Intermittent fasting, like what they do with normal food, and they will be doing fasting. So in naturopathy hospital, usually start with your normal naturopathic bile diet for some days. For addiction patients, if we look at first 7 to 10 days, we to give fasting. So we ask them to go for naturopathy and yoga related diet. So gradually we will make them to undergo fasting. Once we get convinced about them, their behavior and other things. It has happened like sometime in the inpatient department, Dharmasthala or some other naturopathy yoga setup where we have more than 250 bed inpatient bed hospital. So they jump the upon and they run away. This incident might have happened. So gradually we advise them fasting and intermittent fasting, which will be very useful for hypertension. Hypertension could be seen as one of the symptom or complications of addiction. And hypercholesterol, also low carbohydrate diet, is useful for them. And insomnia, particularly evidence is there for valerian herb cherry juice. Acupuncture is particularly very useful. Acupressure, yoga, vipassana meditation, tai chi have shown promise. Particularly in this setup, we give neutral underwater massage, which is very useful for sedative, which is very useful for insomnia, and even full body massage. So it relaxes the muscles and nerves. Useful. And seizures also, there's some evidence for fasting therapy. And alcohol liver disease is one of the case report we published when I was working in SDM Naturopathy Yoga Hospital. They treated alcohol addiction patient, dependent syndrome. Like for almost 1 month, we could see reduction in. Usually we could see elevation in liver enzymes like HTOT, SGPT, alkaline phosphatase. We could see a significant reduction with these enzymes after naturopathy. Even the beginning of the admission, he had hepatomegaly. So at the end, when we did palpation, so there was no hepatomegaly. So subjectively also, objectively also, he improved a lot. So follow-up is one of the key in naturopathy. So after they go back, we don't know whether the relapse rate, how much is the relapse rate. So that is the main concern. Otherwise, to reduce the complications of addiction, to be beneficial as an add-on treatment with conventional medicine, naturopathy is better. And cognitive deficits also, yoga has been shown to be useful. Ginkgo biloba, one of the herb, and curcumin has been scientifically proven to be useful in dementia. And PUFA has been useful. And for cancer, recent evidence suggests fasting has been very useful for cancer because it creates a different environment, which we call systematic differential stress sensitization. So by reducing inflammatory cytokines like IL-1, IL-6, so different environment. So it start that replication, like mutation, has been reduced, and future directions for Naturopathy Yoga in terms of research and clinical activities. So when you look at research, it's very easy for allopathic medicine to have double blinding and triple blinding. It's not possible in naturopathy because majority of patients, they are aware of naturopathy techniques in India and abroad, and even yoga. So only single blinding can be done, and even placebo is not possible in naturopathy. So they are aware of the treatment. So naturopathic yoga can be used as an adjuvant therapy for patient addiction, and prevention and aspect naturopathy can be used. It can come under National Mental Health Program to give a better result to the patients. And as a complications and all symptoms, also naturopathy can play a very important role, like lifestyle modifications and stress management and other things. Subsequently, to summarize, there is considerable evidence for naturopathy, particularly acupuncture and polyunsaturated acids, exercise for patient addiction. There is some evidence for fasting therapy and nutrition and dietetics. Still more studies has to be done, multi-cell studies has to be done, randomized controlled trials has to be done to confidently we can say that naturopathy and yoga will be useful for patients with addiction. But time being, it can be given as an adjuvant treatment. Thank you.